This is a video in service discussing the Trio CT temporary triple lumen dialysis catheter from Medcomp. I have another video up where I go into detail about the Trio CT and its benefits over the competition, and I do discuss that it is the best performing temporary triple lumen dialysis catheter on the market right now. Beat out the last two that have been on the market forever, and most people are familiar with the Dialysis and the Mahuka catheter. Dialysis has pretty much owned most of the market because if anybody's ever used a Mahuka, the flows aren't great and you run into a lot of technical or anatomical issues, and technical issues such as most commonly the catheter kinks a lot. So you'll get a lot of phone calls that patient's dialysis treatment's not going well, the flows are poor, or it's not working at all. So therefore, most people globally have been using Dialysis for a long time, and now we have a new one on the market from Medcomp, who always is innovative when it comes to venous access products. This product's the Trio CT, and this beats them both out. The flows against Dialysis from Bard are flow dynamics at 400 flows. This catheter has 10% lower pressures than the Dialysis, 30%, at least 30% lower, if not more, than Covidian's Mahuka catheter. So this blows them away. And it's actually interesting if you look at the actual IFUs. Those numbers that I just went over are from head-to-head studies our engineers do. But if you actually look at the IFUs, it's even more interesting. Here's our IFU insert that's in every package, and it shows you that at 400 flows, a 24 centimeter Trio CT catheter, they're all 13.5 French, 24 centimeter. Venous is 76, average pressure is 76, arterial is -80, and that is at 400 flows. So 76, -80. If you take the IFU out of your Bard Dialysis catheter and look at that, it's pretty interesting because at 400 flows on a 24 centimeter catheter, now granted this has curved extensions, so that counts for a little bit of the difference, but the venous pressures are 197 and the arterial are -204. That's pretty significant. So this catheter clearly outperforms anything that's out there right now that's power injectable. You have 2 ports for your treatments and 1 port for medicines, pressure monitoring, CT injections. All that comes in various sizes up to 30 centimeters, which is perfect for femoral placements. This here is the max barrier set. So I'm going to show you the Trio CT and go over its benefits, but also show you what the bedside kit. So if you're in the ICU setting, critical care, this is the kit that you would see. This kit is great. It's got everything in it that you need, including a full body drape. When you first peel the kit open, you have your bouffant cap, you got a mask, you got a face shield mask, you got gloves, non-latex gloves, of course, 7.5. And then you open the actual inside of the kit, you got your chlorhexidine scrub, you got a gown, as I said, a full body fenestrated drape, which is great because nowadays you want to cover the entire bed, patient, and everything so that you don't have, you minimize risk of infection. Inside the kit here is, again, everything you need for a bedside placement is in here. We're working on getting the lidocaine and saline syringes in the kit. This demo has it in there, but currently it's not, but it will be very shortly. Not far from now, it will be actually in the kit, so you don't have to pull it from the Pyxis. So you got chart sticker, you got a card for the catheter, tegaderm, got some towels, syringes, prep sticks, needles, gauze, you got the micropuncture, or the not micropuncture, you have a 18 gauge needle in this kit, dilators, you even have some hemostats, and then our wire, which comes with a device here that you can, if you're placing this by yourself as a resident or fellow or physician that doesn't have any help sterile with them, gloved, you can use this to help get that wire into the catheter. It's real nice. And then here's the Trio CT catheter itself, which I went over in my other video. It's a great catheter. You can tell it's got huge lumens for dialysis treatments, double barrel shotgun with a smaller lumen here at the very tip for your wire to go through them for your CT injections. This tip is designed, unlike any other catheter, to glide through the tissues. If you have scar tissue, it also will go through there with ease. It has dilators to help. You should always dilate first under fluoroscopic guidance. And on the side, you have your side holes. So it has side holes and ginormous end holes, which makes this catheter so well performing. It's also very kink resistant because it's made from the polyurethane that most of Medcomp's products are made from. This is stiff to get the catheter in, and then shortly after insertion, the temperature of the blood warms it and makes it soft, so it's less traumatic. And this tip design also is made to be very atraumatic inside the patient. It's almost like a bumper tip, but when it gets in the bloodstream for a few minutes, it really gets soft. It helps minimize any type of trauma that could happen from the tip of the catheter. CPR is also a common thing that you hear with catheters in the patient, and someone's pounding on the chest. The catheter tip can bust through the ventricle or the atrium. It's not that common, but it happens. With this, it's a little softer. And here's your dialysis lumens, and then your central power injectable purple lumen, 5 cc's a second. As I said, you can measure pressures, you can do CT injections, give medications. It also has a rotating hub in case your nursing staff needs to adjust this catheter for function. It helps a lot, so you don't have to cut the stitches. And it allows you to have dialysis access and a Mediport or an IV access all in one stick, so you minimize the amount of sticks the patients get and the amount of procedures. It makes the staff happy because they have all the access they need, and it makes the patient very happy because they're not getting stuck multiple times, patient and or family. So it helps there with patient satisfaction, helps with your Press-Ganey scores, and minimizes risk of infection, so your infection control department really like that as well. So it makes everybody happy across the board. And that is the Trio CT temporary triple lumen dialysis catheter from Medcomp. Another innovative product. I hope that you find this video helpful. If anybody out there really wishes they could have an in-service and they can't get a rep in, hopefully they find this video and they find it very helpful, and it helps you take care of your patients.